webinar links from everywhere reaching to your mobile, marking the day. So we are doing the same for celebrating World Sepsis Day. And to start with, I must say the brief about how it was started is Global Sepsis Alliance, which was founded by Konrad Reinhardt, one of the pioneers in sepsis. He was the founding chairman for this alliance, and hence the headquarters is in Berlin. It was founded in year 2010, and from then on, this alliance is forging alliances with all societies and organizations. So, our organization, Academy of Critical Care Medicine, has also signed a declaration which was formulated by Global Sepsis Alliance. And if you know about this declaration, they have a vision that by 2030, if we follow certain protocols in our hospital and if we educate our society, probably then we can reduce the deaths by sepsis. Why it is important? Because it is number one killer worldwide. And to go ahead, to begin, what is sepsis? As we all know, it is body's response to an infection when it injures its own tissue and organ. The infection is now retermed as sepsis. It may lead to shock, multi-organ failure, and death, especially if not recognized early and treated promptly. So, sepsis is infection which is life threatening because of its own immune response, which was dysregulated, particularly in those people. So, if we recognize it early, then is the chance that we may save a life. And here comes the importance of preventive aspect. Last year or this year in May, what we have seen is COVID pandemic has taken a great toll worldwide, and the killing was mostly 50% of the time is because of sepsis. So if we prevent it, like healthcare personnel and people above 18 years have been vaccinated. So this is one of the preventive aspect. If we prevent infection, probably then is the chance of reducing the sepsis. So if you know the burden, how it is killer, it is about 47 to 50 million cases per year. People are affected by sepsis, and out of them, 11 millions are dying. That will make it as a one death every 2.8 seconds. And even if people survive, they do have some lifelong consequences. And one in every five death is now associated with sepsis. If not absolute cause of death, it is associated cause of death, that is attributable risk. And we know common sources are from any system, be it brain, soft tissue, hospital acquired infection, catheter related infection, abdominal infection, pneumonia, or infection of unknown source. Mostly we get people in shock, and then when we investigate, what we get is there is infection, but we cannot localize it to single organ or organ system. So probably these are the cases whom we need to tackle. For layman or for general public, this is GSA's slide where they put emphasis on word sepsis and try to make symptoms from this word. So S is for slurred speech or confusion. E is for extreme shivering or muscle pain or fever. P is for passing no urine all day. S is again for severe breathlessness. I, it feels like you are going to die. And S is skin mottled or discolored. So they try to make a mnemonic for symptomatology, and that mnemonic is sepsis. So if you have any of these symptoms, probably you need to go for quick SOFA. As a physiology behind sepsis, it can be from a local infection spreading everywhere, or we know it is the immune response which is at fault because it becomes dysregulated because of overwhelming infection, leading to endothelial damage and circulatory failure, causing organs to fail and finally leading to death. But there are certain risk groups who are at higher risk for sepsis, and they are people with chronic diseases like any chronic disease of any organ, lung, liver, heart, people whose immunity is compromised like diabetes, AIDS, or a person with asplenia or post splenectomy, and extremes of age, a child under 1 and the adult over 60. So particularly these people need to take care that they should not get infection, and if they acquire some infection, it must be treated aggressively. Then what to do to prevent sepsis? To prevent sepsis, we need to prevent infection. And to prevent infection, we have some modalities. As we have seen last year, COVID pandemic, and the preventive aspect is vaccination. So we know the importance of vaccination in such pandemic. Then comes a old tested method of hand hygiene. Then comes your nutrition or a water intake, what water you are drinking. Then hospital acquired infections, which are on surge these days because of so many reasons out of the scope of this presentation. Childbirth and associated deaths, maternal or neonatal deaths, needs to some improvement. And then general awareness about sepsis, how it is different from infection. People often tend to think infection as sepsis, but it is not so. Infection, when is overwhelmed the immune response, or when your immune response becomes haywire, particularly damaging your own endothelial cells and organs, then that infection probably would be called as sepsis. Why I'm stressing this difference between infection and sepsis is because if you treat aggressively all infection with antibiotic, probably, as we know, and we are living in an age of antimicrobial resistance where utilizing antibiotic judiciously is warranted, and hence we are practicing antibiotic stewardship to help reduce this burden of AMR, antimicrobial resistance. So we need to be very sure when to treat a patient of infection and with what. If we have a high risk group, particularly child below 1 and geriatric populations above 70, and having infection which is like taking time to go off, then is the time to start these people on antibiotic. Rather, what we should do is we should watch them closely and try to find out what antibiotic would be judicious when used empirically, and then target your infection accordingly. As we are very well versed with 5 moments of hand hygiene, which is very clear that you need to wash your hand or hand rub before touching a patient or after touching a patient, or after touching any body fluid, or before any procedure, or after touching a patient's surrounding. So these are the 5 moments where you need to keep in mind that you need to do your hand wash or hand rub. Doing this simple maneuver will cut the chances of infection to your patient drastically. And it is one of the most simplest and proven way of reducing the infection rate and antibiotic utilization in hospital. So putting emphasis on this, we have a program tomorrow at Bhopal Fracture Hospital where we are trying to teach our housekeepings and paramedics about the importance of hand hygiene. As we know that though they have marked with 12, but it is not necessary. You can have your own way of cleaning your hand. The only thing which we need to keep in our mind is it should be complete hand, leaving no part without rubbing with solution or a hand rub. As I have talked about post sepsis syndrome, or symptoms which are malingering these survivors, sepsis survivors, even after discharge, and they usually do need some psychological support, some physical support, or both. So, as I have talked about 11 millions are dying, and out of them 50% are having some post sepsis syndrome, which is causing a reduction in their quality of life. So it is not only life which is important, rather, we need to have some rehabilitation facilities for these sepsis survivors. And what GSA is doing is they are trying to bring all the stakeholders on the common platform so that their vision 2030, which is to increase the awareness amongst people in general and in policy making in particular, like governments, need they are putting emphasis to make it as a health program, and they have put some quality indicators which should be measured routinely and should be in public domain. And they wish that at least about 20% of the nations with high income category, not low or middle income category, by 2030 would be fulfilling these visions of putting the datas of sepsis and its related cost in public domain. I don't know whether India does have any program of any such sort or not, but it is highly required. To mark, as we have discussed, sepsis is not a disease but a syndrome, which is a common pathway of any infection which is causing death. So, as we have seen, there are certain group of people who are prone to infection and hence sepsis. So, to mark the day, today we are celebrating World Sepsis Day. We need to keep in mind there are celebrations worldwide about various diseases marked with their days. Like we see World Cancer Day being celebrated every 4th February to mark the importance of identifying and treating cancers early. And we know that these cancer patients are very, very prone to sepsis and have 43% higher chance of dying from sepsis than other non-cancer patients. So this is Cancer Day. Then we have World Tuberculosis Day. Why these celebrations are important is to, as we know, in our Indian system, value system, we do have celebrations like Ganapati. We are through going through that. Why it was essential to celebrate is to make people aware of importance of several things. So what I feel is today's world needs celebration of a sort of World Sepsis Day, World Tuberculosis Day, World Cancer Day, and make everyone aware of how to prevent it from happening. And if it is there, don't hide. Come show your illnesses and try to get yourself treated scientifically. So this is a celebration where we are putting emphasis on Sepsis Day and other celebration related to Sepsis Day. As we know, World Health Day is being celebrated on 7th April and World Immunization Day in the last week of April. April 24th, we have World Meningitis Day to mark the importance of it. World No Tobacco Day, as we know that smoking is a risk factor for sepsis. Blood, we know that sepsis patients do require blood at time, so need to increase the pool of blood by celebrating World Blood Donor Day. World Hepatitis Day, as we know that though hepatitis doesn't cause sepsis in itself, but it decreases your immunity and hence making you prone to infection and further sepsis. Same with AIDS Day on 31st December. What I have presented today is basically a template of slides from Global Sepsis Alliance, and there are several alliances. The leader would be Global Sepsis Alliance, under which several regional bodies have been framed. And if you have time enough, then we can discuss those Vision 2030 post presentation. So, this is my final slide. I'll be ending here. Thank you very much. Now, the house is open for discussion. You can unmute yourself and ask question. Or you, if you want, I'll tell
Yes,
you.
Santosh. Yes, Santosh. Is
Ah,
there any
yes, sir.
new protocol? Hi, Santosh. Is there any new protocol they have launched to fight against the sepsis on this World Sepsis Day, or something new slogan, something like that?
What in 2021, this Global Sepsis Alliance has already done its World Sepsis Congress in April, and
Okay.
where they have talked about pandemic, its how to reduce infection or prevent it, how to identify it early and then manage sepsis so that you get a better outcome. So, as we know, science wise, there is not much which has come to us, which we can use at our place and improve the survival. So we have gone to preventive aspect of infection, and further prevention is the cure for sepsis as well. If you reduce infection, that way you are going to reduce the mortality of infection and sepsis. Because if you simply try to reduce it by managing well in ICU, probably it would not be enough, because we know that there is some complications related to post sepsis syndrome, which they often complain of even after surviving a sepsis episode. So the world has moved from treating at ICU to making people aware at the community level, so that infection reduces and hence the chances of sepsis and its death. So, marking the day, we are talking about preventive aspects and why it is important.
No, I'm
Avni
talking
has
about some. Yes, 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 Santosh. Go ahead.
Avni has asked one question on chat box: how to do antibiotic stewardship. Avni, it is very difficult to talk of antibiotic stewardship straight away, but what I can talk is this is the need of the hour. As we are seeing in our ICU patients, any patients in ICU, if there is some fever, despite of antibiotics, we probably change our antibiotic or escalate it to higher antibiotics. This is a usual prevalent practice wherever in India or outside as well. And what it has led to is a generation of antimicrobial resistance amongst all sorts of microorganisms. And now we are as if we are in pre-antibiotic era, where we do not have access to any antibiotic, or a post antibiotic era where we do not have any antibiotic left to further save your patients. So, antibiotic stewardship is a concept where you are being taught about the importance of antibiotic, where antibiotic is a precious drug which you give not just empirically, but rather you need to have some thinking behind it, whether my patients need antibiotic, whether this is a viral or bacterial disease. If it is bacterial disease, which organ system is involved, whether it is lung, abdomen, skin, because basis that you need to take your antibiotic which has the highest penetration at the particular site. So antibiotic stewardship is a science behind prescribing antibiotic, where you try to reduce the use of antibiotic, rather focus mentally, have some wrestling with your brain and knowledge, and then you pick up one antibiotic to start with, and then plan accordingly. Then how long are you going to continue with your antibiotic? What if the reports come later of something? How are you going to change one antibiotic to another? So this is an entire series of thing included in antibiotic stewardship. We can't talk of antibiotic stewardship as in a 1 hour or 2 hour. Rather, it needs 2 to 3 days of uh, whole discussion sort of activity to better understand it. So I think antibiotic stewardship for a beginners would be to question your question, 5 or 6 basic questions. Do my patient has infection? First thing. If I have a patient with infection, do this patient has bacterial infection, rather viral or parasitic infection? And if they have some bacterial infection, which organ is particularly affected? And if you have focused on one organ, then which antibiotic will reach to that organ efficiently? You need to think about all things. So antibiotic stewardship is like uh, um, you need to be very refined in your approach and think more and do less, or treat less, is more of a antibiotic stewardship.
Sir, I would like to add one point here. WHO is running a online, self-directed course for antibiotic stewardship also. If and it's free of cost. All we have to do is just go on the website of WHO, and anyone can just log in and get access to that self-directed course of antibiotic stewardship. It is very well organized, a very good course, and it's very beneficial for all us clinicians.
Thank you, KK. Avni,
No, Santosh ji.
have you got the answer, Avni?
She is there or she left the meeting?
Okay.
Santosh, you
Haji
have
sir,
nicely
Haji sir, I
described
got
the.
it.
She is there. She is there.
Santosh,
हाँ
you
I
have
Avni,
will.
go
nicely
ahead.
described
Haji
Santosh
sir,
and KK.
sir, लेकिन
Yeah. हाँ, हाँ,
hello.
Yes, Avni.
Haji, sir, is there any protocol of sending cultures within 1 hour of diagnosing that this patient might go in sepsis in the future?
Nothing like that.
Does
Nothing like that. It can't be. It can't be. If you have infection, and if you have you are doing cultures, you are talking of blood culture, I mean. If you are
blood
going to if you have infection, and if you are taking blood culture, with why are you taking blood culture? That
संतोष जी गए.
if
तुम
if
कहाँ जा रहे
if,
हो?
if by any means your blood
पेशेंट है
culture
क्या कोई?
grows something, then
पेशेंट है क्या कोई?
that means that that
और पेशेंट
particular organism which you are culturing and you are
अकाउंट
acquiring it
दिखा.
from blood probably have reached blood from somewhere. So as we know that blood should be sterile. So if it comes positive, doesn't tell you that it is sepsis. It tells you that it is bacteremia, probably because of some infection sitting somewhere, reaching to blood. But this is telling you about the one aspect of sepsis.
दूसरा
Sepsis
केक
is
भी फिक्स हो
not
गया
in
है.
itself only
बायोलॉजिकल साइनस करेंगे.
invader.
सर चलने से
It
पहले
has
पूरा
to
से
be
आएगी.
host as well.
फोन पे बोल दिया खाली पेट रहेंगे.
So when there is an interaction between host and invader and the host immune response goes haywire, then is the particular time when you think that so while doing such things, if you have done a blood culture and it is coming positive, so you know that you have an organism to act on. So that way it will help you in deciding what particular organisms is actually causing problem to my patient. But the other side is the host or the host immune response. Sometimes it is not the organism, rather the host haywire immune response, which is killing the host itself. But this microorganism being the trigger of those phenomena. So at that particular point of time, there comes the role of treating the cause. So treating the cause is directed to organism and the organ system involved. Secondly comes all the supportive system or the anti-inflammatory therapy, what we know of, is being bombarded in hope that we'll get everything streamlined. But it doesn't usually happen. And if what people have got going ahead on this philosophy, they try to look into why this particular persons are dying because of sepsis and other who is having more severe infection, more bad infections are actually surviving. And what they have found out is there is a genetic link behind sepsis. There are certain group of people who have their genetic constitution like that, where they where their immune system behaves haywire. So it is so the focus now is shifting towards the host rather than the invader, and hence comes the philosophy and this antibiotic stewardship. Antibiotic stewardship is actually meant to do that. Your invader part will be taken care by antibiotic, but what about the immune response which has been triggered by the invader? So it is basically to answer those that though we are living in a world of AMR and where no antibiotic is actually helping, but even though when we find patients in our ICU, if you have noticed, we have seen patients with PDR and treated them with antibiotic and they have not died. Why so? Because their immune system is okay. They are trying to fight out, they are not overdoing or underdoing it. So once you have a set of patients who are such, then particularly your antibiotic therapy will help you. So, taking a blood culture is a good practice, but you need to do it in a proper way. Sometimes people taking blood cultures are not trained how to take it. So, they may grow something which may be like skin flora, and you should not treat skin flora unless and until you have some symptoms associated with it. So be very careful, and this is what antibiotic stewardship is all about. You need to think beyond antibiotics, beyond host, and you need to club all your knowledge, think, and then come out of your wrestling situation of brain and then win it.
जी sir. Okay, sir.
Any more questions?
Santosh, it was